Hello dear learners, I welcome you all to this module on English for Nursing and Healthcare 2, which is a part of the MOOC on Introduction to Functional English. From the previous module, you must have understood the role of English language in the field of nursing and healthcare, which is very crucial for nurses, especially as they remain with the patients right from the time they enter the hospital premises till they leave and afterwards too. Conversations between doctors and their patients are most often serious discussions about the symptoms of a sickness or the improvement in health after a particular surgery or course of medication. So dear learners, for this same reason, it is very important to maintain the tone and seriousness of the discussion when you are writing a conversation between a doctor and a patient. Language here is more formal and a lot of medical terms are used during the interaction between a doctor and patient. This module shall help you to understand the skills of formal communication through English on the part of both the doctor as well as the patient when they require to interact in a hospital or in a clinic. So basically, the objective of this module are to discuss the importance of communication during the conversation process of doctors and patients. Discuss the rules to follow while conversing or interacting with the patients and providing care and support by the doctors. Find out some of the most commonly used terms in a hospital situation. Last but not the least, learn some of the tips of communicating in English in a hospital situation. So let us begin with our module. The doctor and patient communication is a central clinical function in building a therapeutic doctor-patient relationship, which is the most important part of medication. This is important in the delivery of high-quality healthcare. Much patient dissatisfaction and many complaints are due to breakdown in the doctor-patient relationship. However, dear learners, many doctors tend to overestimate their ability in communication. Hence, we should always see that a doctor's communication and interpersonal skills should be encompassing the abilities to gather information in order to facilitate accurate diagnosis, counsel appropriately, give therapeutic instructions, and establish caring relationships with patients. Dear learners, these are the core clinical skills in the practice of medicine, with the ultimate goal of achieving the best outcome and patient satisfaction, which are essential for the effective delivery of health care. The ultimate objective of any doctor-patient communication is to improve the patient's health and medical care. Some studies on doctor-patient communication have demonstrated patient discontent even when many doctors considered the communication adequate or even excellent. Doctors tend to overestimate their abilities in communication. Patient surveys have consistently shown that they want better communication with their doctors. So we are with this module to help you understand what a communication between a doctor and patient should be. Effective doctor-patient communication is a central clinical function, and the resultant communication is central component in the delivery of healthcare. The three main goals of current doctor-patient communication are creating a good interpersonal relationship, facilitating exchange of information, and helping the patients in the decision-making process. So dear learners, effective doctor-patient communication is determined by the doctor's behavior beside them when they are admitted, which patients judge as a major indicator of their doctor's general competence. Good doctor-patient communication, dear learners, has the potential to help regulate patients' emotions, facilitate comprehension of medical information, and allow for better identification of patients' needs, perceptions, and expectations. Patients reporting good communication with their doctors are more likely to be satisfied with their care and especially to share pertinent information for accurate diagnosis of their problems, follow advice, and adhere to the prescribed treatment. Patients' agreement with the doctor about the nature of the treatment and need for follow-up is strongly associated with their recovery. A more patient-centered encounter results in better patient as well as doctor satisfaction. Satisfied doctors are less likely to lodge formal complaints or initiate malpractice complaints. Satisfied patients are advantageous for doctors in terms of greater job satisfaction and less work-related stress. So, dear learners, there are some barriers to good and effective communication in the doctor-patient relationship as there are barriers to normal communication process. So, these includes patient's anxiety and fear, doctor's burden of work, fear of physical or verbal abuse, and unrealistic patient expectations. So, let's go through some of the basic barriers of this effective communication in the process of doctor-patient relationship. So the very first factor that comes is the deterioration of doctors' communication skills. It has been observed that communication skills tend to decline as medical students progress through their medical education, and over time doctors in training tend to lose their focus on holistic patient care. Furthermore, the emotional and physical brutality of medical training, particularly during internship and residency, suppresses empathy, substitutes technique and procedures for talk, and may even result in the contempt of patients. The second barrier is non-disclosure of information. The doctor-patient interaction is a complex process, and serious miscommunication is a potential pitfall, especially in terms of patient's care, expectations, and involvement in treatment. These important factors may affect the choice patient makes regarding their treatment, which can have a significant influence on the disease. Good communication skills practiced by doctors allows patients to perceive themselves as a full participant during discussion relating to their health. The third important barrier that comes in the doctor-patient communication, dear learners, is doctors' avoidance behavior. There are reported observations of doctors avoiding discussion of the emotional and social impact of patients' problem because it distressed them when they could not handle these issues or they did not have the time to do so adequately. This situation negatively affected doctors emotionally and tended to increase patients' distress. This avoidance in behavior may result in patients being unwilling to disclose problems which could delay and adversely impact their recovery. The next barrier, which is in line, is discouragement of collaboration. Some physicians tend to discourage patients from voicing their concerns and expectations as well as requests for more information. This negative influence, dear learners, of the doctor's behavior and the resultant nature of the doctor-patient communication deterred patients from asserting their need for information and explanations. Patients can feel disempowered and may be unable to achieve their health goals. The next barrier that is resistance by patients. Today, patients have recognized that they are not passive recipients and are able to resist the power and expert authority that society grants doctors. They can resist the monologue of information transferred from doctors by actively reconstructing expert information to assert their own perspectives, integrate with their knowledge of their own bodies and experiences, as well as the social realities of their lives. So as we have now gone through the barriers, so let's see some of the steps for improving our effective communication between doctors and patients. So dear learners, the very first important step for improving effective communication is better communication skills. So you have already learned from the previous module that communication skills involve both style and content. Attentive listening skills, empathy, and the use of open-ended questions are some examples of skillful communication. Improved doctor-patient communication tends to increase patient involvement and adherence to recommended therapy, influence patient satisfaction, adherence, and healthcare utilization, and improve a quality care and health outcome. The next step is communication training. So dear learners, doctors are not born with excellent communication skills as they have different innate talents. Instead, they can understand the theory of good doctor-patient communication, learn and practice these skills, and be capable of modifying their communication style if there is sufficient motivation and incentive for self-awareness, self-monitoring, and self-training. The next point, that is collaborative communication, is a reciprocal and dynamic relationship involving the two-way exchange of information. Doctors should be collaborative with their patients to provide the best care because doctors tend to make decisions based on quick assessments which may be biased. So dear learners, this requires the doctors to take time or set up opportunities to offer and discuss treatment choices to patients and share the responsibility and control with them. Care options need to be collaborative between doctor and patient, taking into account patient expectations, outcomes, preferences, level of risk acceptance, and also any associated cost to maximize adherence and to assure the best outcome. The fourth point or the fourth step which we will be discussing is conflict management. Conflict is often a challenging situation as it can evoke feelings of helplessness, frustration, confusion, anger, uncertainty, failure, or sadness. The doctor should recognize these feelings and develop skills to identify problematic responses in the patients or themselves to de-escalate the situation and enable the relationship problems to be turned into a clinical success. Effective doctor-patient communication should involve productive conversation which involves understanding of both parties' perspectives. So dear learners, as we have now learned the barriers and the steps, so here are some do's and don'ts of doctor-patient conversation. So first we will go for the do's. Do make small talk. So doctors should be able to make small talks with their patients. They should be able to make the patients comfortable to discuss their ailments freely with them. Do show empathy. Doctors should be empathetic towards their patients. Showing empathy is as simple as a few well-chosen words. Do consider the patient's method of understanding the situation. Doctors should use spoken words and they are the best way to communicate complex health information to people of all health and literary levels. Do ask if all the patient's questions are addressed. So, doctors should encourage patients to make a list of their concerns in advance of their appointment to help stay on schedule. Now, let's move on to the don'ts. Don't interrupt. After the doctor asks or confirms why the patient is there, the patient should be given at least 2 minutes to talk before deciding anything. Don't turn your back on patients. Patient satisfaction is very crucial when doctors spend more time looking at their patients and not turning their backs on them. Next, we have don't use jargons. Simple and easy words used by the doctors help the patients to open up better and help make better connections. Don't dismiss patients' concerns. Minimizing the patient's concern is dangerous. The doctor should treat the patients as though their concerns are trivial, or else they will be unlikely to share important information with them in the future. So, dear learners, as we have told in the objectives that we will be learning some very common terms that are used by the doctors or patients while interacting, but these are not only the ones that are specific to this topic. We can discuss them more elaborately in the TLM that will be provided. So here we have just a few words that are very, very common to medical use. The first word, that is biopsy, a small sample of tissue that's taken for testing. Chronic, which signifies a recurring, persistent condition like heart disease. Fracture means broken leg or cartilage. Gland is an organ or tissue that produces and secretes fluids that serve a specific function. Hypertension means high blood pressure. MRI, this stands for magnetic resonance imaging and is the next step up from a CT scan. It uses magnetic fields and radio waves to see inside your body in great detail. Appendectomy, which is a surgical procedure to remove the appendix. ICU, which is intensive care unit. Vaccine, I think, which is very common and you learners should have an idea of it, and it is actually a substance that stimulates antibody production to provide immunity against disease. Cardiology, which means anything that is related to the heart. Dermatology, which is any disease related to the skin. Gynecology are conditions that are unique to females. Andrology, conditions which are unique to males. Neurology covers the brain. So, dear learners, these are few terms which we have come across in the medical usage, but there are even more which will be covered in the TLM that will be provided. So, dear learners, as we have now come across the barriers, the steps to improve for effective communication, and also some terms that we use in medical conversations. So now let us look at some of the sample conversations in the healthcare sector and see how in different situations and contexts English can be used.
Please send in the next patient.
Hello, doctor. Good morning.
Good morning. Please have a seat and tell me what seems to be the problem.
Doctor, I have been experiencing severe back pain, especially after sitting for long periods.
I see. Let's run some tests to check for any issue with your spine. In the meantime, try to take regular breaks from sitting and do some light stretching exercises.
I will follow your advice, doctor. Thank you.
You are welcome. Take care.
Good morning, doctor. Can I come in?
Good morning. How are you feeling today? You seem a bit under the weather.
Indeed, doctor. I have been feeling unwell for a few days. I have a headache, a runny nose, and a sore throat.
I see. Let's check your temperature and throat. Have you been in contact with anyone who is sick?
Not that I am aware of, doctor.
Well, it seems like you have a flu. It's important that you rest, hydrate, and take the prescribed medication. Also, avoid contact with others to prevent spreading the virus.
I will do as you say, doctor. Thank you for your advice.
You're welcome. Get well soon. Good afternoon, doctor.
Good afternoon. How can I assist you today?
I have been feeling constantly thirsty and tired recently. I also noticed that I have been losing weight without any effort.
I see. Let's run some tests to find out what's going on. It could be diabetes, but we need to confirm it.
I understand, doctor. I will await the test results.
Good. In the meantime, try to eat a balanced diet and get regular exercises. These are good practices whether you have diabetes or not.
I will do my best, doctor. Thank you.
You're welcome. Take care.
So, dear learners, we come to the end of this module. From this module, we have learned that the doctor-patient communication is a major component of the process of healthcare. Effective doctor-patient communication can be a source of motivation, incentive, a reassurance, and support. A good doctor-patient relationship can increase job satisfaction and reinforce patients' self-confidence, motivation, and positive view of their health status, which may influence their health outcomes. Doctors with better communication and interpersonal skills are able to detect problems earlier, can prevent medical crises and expensive intervention, and provide better support to their patients. This may lead to higher quality outcomes and better satisfaction, lower cost of care, greater patient understanding of health issues, and better adherence to the treatment process. So, dear learners, I hope we have covered the most important aspects of a doctor-patient communication in this module. So, in the next module, we shall discuss yet another lesson on English for tourism. So, see you again soon. Thank you and have a great day.